Good morning, everyone. Welcome to today's webinar, Fleet Safety in the Time of COVID-19. My name is James Soliday, and I am the Director of Fleet Marketing here at Booster Fuels. Today's agenda, once we dive into this, is how we'll tackle how we all got here and what industries have been most affected by COVID-19. Secondarily, we will dive into what has happened with oil prices and what are the factors that have been driving oil prices up, as well as what are the factors that have been driving oil prices down. We will look at the current market situation with optimism from this. Then we will dive into how to keep your fleet safe. We'll provide recommendations as well as what Booster has been doing on a day-to-day basis to keep their employees safe. And then lastly, we'll talk about what specific industries are doing to stay safe. And then lastly, we'll finish up with a Q&A session. Our speakers today are Jeremiah Cook, who is the Director of Business Development, and he's a bit of our internal fuel expert. He leads our partnerships at Booster and has worked in the fuel distribution industry for the past 7 years. He will be joined with Michael, or he prefers to go with Tree Keister, who is our Director of Environmental Health and Safety here at Booster as well. Tree is a certified safety professional who has been around the oil and gas sector his entire life. He has over 18 years of experience in environmental health and safety with a BS and MS in that discipline.
Thanks, James. Well, I'd like to start by addressing what's going on in the oil market today. And it all started as the coronavirus was moving across the globe and decreasing demand for refined products, that's gasoline and diesel, because people were and still are traveling less for work, leisure, and we've seen a drop in services resulting in weakening demand for fuel. So basic supply and demand economics will tell us that if production levels stay high while demand drops, prices are going to go down. In an attempt to stabilize, the Saudis and OPEC Plus attempted to decrease production. And at one time, OPEC controlled enough of the world's crude production that those countries alone could have likely have impacted the global market with those cuts. However, in the last several years, countries like the US have become major producers of crude, thus diminishing OPEC's overall power. So to affect the market, the Saudis needed a country like Russia to make similar cuts. Well, Russia decided not to play ball, and the Saudis kept up production, which sent us into the largest downslide in crude prices that we've ever seen. In the last week, over 10 countries have finally agreed to cuts, with the Saudi Arabia and Russia shouldering about half of the overall 10 million barrels per day in cuts, which accounts for over 300 million gallons of gasoline and diesel daily being less injected in the supply chain. The market has been relatively underwhelmed with these cuts, with a short and small recovery, indicating it might not be enough to cover the nearly 50% decline in demand that we've seen for gasoline and diesel. As of yesterday, the International Energy Agency published a bearish demand outlook, and the US Energy Information Agency published a report outlining the oversupply of nearly 19 million barrels, which they refer to as glut. And certainly the notable factor that has us sitting at a nearly 18-year price low today. There's even talk that the Trump administration may take domestic action to participate in production cuts. And OPEC has commented that they will continue to make cuts until supply is balanced. So far, none of these actions have shown up in the market, and oversupply is estimated to last for several months. So what does this all mean for us? Well, while there are wide-ranging impacts, I'm going to focus on just a few. And first, some of you might be wondering, how reliable is fuel supply going to be in the next coming months? And according to industry experts, there shouldn't be any concern of any major disruptions in the ability to actually buy fuel over the next several months, barring any weather or geopolitical events that might change that. Some of you might also be wondering what's going to happen to fuel prices. Well, we've already seen a pretty dramatic drop in the price of the crude barrel, but a less proportional drop in retail gasoline and diesel prices. And this is actually expected as retailers are commonly slow to decrease their prices. This is a phenomenon that's referred to as the sticky pump. That being said, we are actually seeing cheaper fuel prices. So it's definitely going to mean that our cost to fuel our fleets will certainly be less in the next several months, even if our volumes were to remain the same, knowing that a lot of us are seeing decreased overall volumes. And as a consumer of gasoline, you may be wondering, how do I take advantage of these record low prices? Well, we'll have some recommendations for that in a little bit. I wanted to follow up with just a couple of scenarios that may result in either a pessimistic or an optimistic look of the market, and kind of finish our discussion around oil markets with a look forward. So while none of us can predict what's going to happen next, we can identify a couple of key things to keep an eye on, which might tell us where we're heading. The top three things that I'm paying attention to is, number one, demand. And this is really demand more specifically as it relates directly to COVID measures. And as long as we're struggling with COVID and you see kind of the major widespread shutdowns, it's going to result in that demand destruction and its lasting impacts. The second is production concerns. So if the cuts can't match the demand destruction that we've seen, we'll see continued pessimism. But I think with a tremendous amount of product and inventory right now, it's going to take a lot of smart action to balance out demand with production. However, if we can achieve that, I think we'll start to see a more bullish outlook. Now, that being said, we're obviously heading into a downtime and things are going to be tough, but if we can get the production right and inventory levels right, I believe that it will weaken or lessen the pain. And then finally, one thing that's, I think, really important for us to be paying attention to is the U.S. economic stimulus. And that's including the current packages and possible future measures. The results of these are yet to be seen, but obviously if they work as intended, there will be a lot more positive and optimistic sentiment that will return to the marketplace. As a matter of my opinion, this might be one of the few market drivers that could actually minimize a looming recession and get us back on track. So with that, I'd like to turn over the conversation to Tree to discuss health and safety.
Thank you, Jeremiah. And thank everyone for joining the call today. I appreciate y'all having an interest in the health and safety of your employees. So to start off, right, a real key responsibility as an employer is to pass good information to your personnel regarding their workplace health and safety. And while COVID-19 has impacted all of our lives, the reality is that the workplace is a place that you're specifically legally required to do that, as well as it being the right thing. So to give that good information to your employees, you want to make sure that you have a good list of resources in your area. The resources that I had listed on the screen are actually applicable countrywide across the nation, but you need to focus on the fact that due to our federal system, right, where the rubber meets the road from a public health policy is always going to be at those local and county health departments. Some more rural areas may only have a county health department and not necessarily have a city health department, but regardless, you can almost interchange those two responsibilities as you move across America. They will be supported by the state health departments and ultimately the CDC. And a way to think about this, while I don't expect a lot of people on the call have spent time inside an operating room, I think we're all somewhat familiar with the TV stereotype around how surgeries work. And it's this idea of a surgeon, staring and focusing intently on an operation they're performing, and they ask for something such as forceps or sutures, right? And then someone hands them that tool. That's kind of the relationship that nurse-doctor relationship that we see with the local health departments, with them fulfilling the role of the surgeon and the state and federal agencies supporting them in that action. So you should always look for your county health department's website as well as the state health department's website. And then you can also get good information from the Center for Disease Control. I would also encourage you to reach out to your health insurance provider and get the telemedicine options that they provide as a part of your health insurance benefit, because it will be a key way for you to minimize risk for your employees from COVID when they have other health issues. So what is Booster doing to combat COVID-19? I think this will probably provide a pretty good model for most of the companies on this call. First and foremost, COVID-specific training. So your employees need to very much know about COVID, how to prevent it and combat its spread, and also what the symptoms look like, which we'll talk about a little bit later. And then social distancing. The first thing we want to do is try and get ourselves and our employees away from the hazard, right? So once we've educated people, now we're going to try and eliminate the hazard. And you can do that. We're doing that for large sections of the population. Something like a third of the population is actually working from home. And that is a perfect example of eliminating the hazard to them. You can institute those 6-foot minimum distances for employee interaction inside your workplace or out and about doing work. You can also, if you have single operator vehicles, use delayed and staggered starts. So that would mean that instead of all of the personnel coming to the yard in the morning and having a pre-job planning meeting and then grabbing the keys and their equipment and heading out, that we specifically make it a very formal and staggered process where you would have one employee come in at 7 o'clock. They have 10 minutes to get what they need to get done and move out. And the next employee comes in at 7:15. That does take some planning, but that's a great way to ensure that your employees have access to the facilities they need to be successful while also minimizing their exposure. Another process can be assigning or clustering of vehicle users. In a perfect world, you ask a driver, most of them are going to tell you they would love to have their own truck. And that's without COVID-19 being an issue. If you have the resources to be able to do that, that's a great way to minimize exposure to other personnel. If you can't do that, then I would suggest you cluster. And what that looks like is, imagine you have one vehicle for every 2 people. You ensure that 2 specific people are assigned to that vehicle for day shift and night shift. And those 2 people don't migrate to other vehicles, okay? And that way we are once again limiting the population of people exposed to each other. And then increased routine janitorial cleaning has to happen for all of your real estate spaces. You need to make sure that all of the high touch services such as refrigerator door handles, counters, bathrooms, doorknobs, the key box, if that's where you store the keys for your vehicles, all those are getting cleaned routinely. And it's much more than what would have been happening prior to COVID-19. So instead of having those spaces cleaned once or twice a week, they need to be moved up to 3 to 5 times a week, depending on what your days of operation are. A thing that we can do to start giving our drivers some stake in what they're doing is documented pre-trip and post-trip inspections that include sanitizing surfaces. The real key here is that every driver needs to sanitize their vehicle before they get in it at the beginning of the day, and then after they're done at the end of the day. This means that every driver has a vehicle that's been sanitized twice prior to them using it. And then specific COVID-19 inspections. So this may be a way for you to actually enumerate the specific steps you want them to do and what things you want them to clean using a sanitizing agent. Now, I will encourage you that when you go to get a sanitizing agent, you spend a lot of time finding one that is available, while also doesn't necessarily have a lot of byproducts. Bleach is a very common sanitizing agent that people are very used to seeing. However, it's in short supply, and most commercial ways of getting it. You can't go to Costco, Walmart, Sam's, etc., and buy a bunch of bleach. Also, bleach has a tendency to have a pretty high reactive rate in a population. People don't like the smell, the skin irritation, etc. So the EPA has published a list of chemicals that are approved to sanitize for COVID-19. One that seems to be very popular and has widespread availability is quaternary ammonium, sometimes called SaniQuat. So the other piece is you can have your vehicles sanitized routinely by outside services. This could also be something you have to do if you have a worker that gets an exposure, which we'll talk about in a little bit, but companies such as Stericycle, Clean Harbors that deal with environmental issues have the equipment and the training to be able to come and sanitize your vehicle routinely. And then if you have to have people that are operating within that 6 foot distance of each other, it's very important that we use PPE. And not to get to be too much of a safety nerd, but PPE is always the last line of defense. So you need to think of PPE as a way of saying, hey, this hazard is so ubiquitous that I can't protect you from it without putting something between you and it, like a shield. And so for us in COVID-19, right, that shield is the use of a face mask and a face shield whenever our personnel are operating within 6 foot of each other. There are some very specific times as a commercial motor vehicle operator that by DOT standard, which hasn't been relaxed, I have to have people within 6 feet of each other. And that is specifically whenever you have a new driver come in and do a test drive in your vehicle. You really do need to have 2 people in that vehicle, and they're both going to have masks, and they're both going to have face shields, and they should sanitize into the vehicle. So sanitize the space they will touch while they are riding, and then at the end, sanitize on the way out. Kind of next, I'd like to talk about, what happens when. So social distancing throughout America appears to be pretty successful. If you'd asked me that question 4 weeks ago, I might have been a little cynical, but the proof is in the pudding when we look at the numbers and the slow adoption that we've seen recently of hospitalizations, ventilator usage, or fatalities. So that doesn't mean we're out of the woods yet. We have to keep these social distancing measures in place. And as you look at the government, you're seeing a lot of talk in the news about what measures will we use to know it's safe to start relaxing those social distancing. You need to make sure that your employees are prepared if they or someone they know develops the virus and what they need to do. Right now, I believe the numbers are something like in the past 4 weeks, 22 million Americans have lost their job as a result of this. When those people come back into the workforce, you need to realize that they are going to bring with them more exposure to COVID-19. Not that the exposure doesn't exist with those who are already employed, but we're just increasing our sample size. So every employee should know that the COVID symptoms, the fever, dry cough, tiredness, and difficulty in breathing. Every employee should know not to come to work if they're sick or if someone in their home has a positive result or is awaiting a COVID-19 test. You should be able to point your employees to how to get testing. So you should know where the testing is happening in your local area. Once again, you can get that from your local and county health departments. And then once tested, employees shouldn't return to work without a documented negative result. Now, in this, you need to partner with your HR team to ensure that that employee gets all of the help they can get. The bills that have been passed by Congress and approved by the president are meant to help people in that situation. So we need to make sure they're properly taken care of. Involving your HR team will be very important. And as we look at those industries that have been most impacted, that our customers are ours, right? It's not necessarily a big surprise. So we see that the education sector for transportation is down almost 100%, or is down 100%, which makes sense for all those parents doing their best to try and school their children while they can't get to public schools. Corporate fleets and shuttles are down significantly because a large portion of those businesses have switched to a work from home model. Auto dealerships in general, I think consumer spending is down something close to 8% just in March. And so we would expect that. Medical transport, and this is non-emergent. So this is transport shuttles for doctor's appointments, paratransit shuttles, et cetera, is down 68% because we've seen our whole healthcare system shift from normal business to really attacking and targeting COVID-19 patients. I can tell you where I live in Texas that non-mandatory, right, non-elective, only non-elective surgeries are being allowed. So those elective procedures are being postponed. And then catering, obviously, if people aren't going to work, there's not near as much catering happen. When we look at those industries that are somewhat impacted, food and beverage distributors, especially those that support restaurants, are down roughly 30%. We see utilities down 28%, which is, I would attribute to the general decline in the American economy just because of the layoffs and the number of people who are no longer out and about working from home. Plumbing is down 17%, environmental remediation is down 15%, landscaping is down only 14%, which is really kind of an attribute. A lot of times people think of landscaping as, you know, putting pretty flowers in a flower bed, but they really play a key role in a public health perspective in limiting combustible load around buildings, right? So a lot of overgrown grass and flower beds and trees that aren't being taken care of become a fire hazard if they're not actually maintained. And then we look at those that have had the least impact. Consumer food delivery, I mean, that makes sense, right? A lot of people are trying to do takeout Tuesdays to support their local food companies or restaurants that they've frequented in the past. Cleaning services are still having to be required, and why we have a big percentage of the population that's no longer having to be cleaned at work, right? We have seen a real increase in the number of times that a janitorial service goes to one business because they're doing increased cleaning. And then construction continues. I don't know of any place that has suspended construction because it's considered an essential activity. Emergency medical transport is only down 1.17%. Please think about how special that number is. I do believe 2 weeks ago, New York City had more 9/11 calls than they did on 9/11/2001 as a result of the COVID-19. So, and then moving is up 13%, and then delivery and shipping, really those people that are keeping all of us who are sheltering in place at home supplied so we can limit the amount of times we have to go out is up 14%, and we definitely thank them for that. When we look at you know, kind of the industry best practices and for food distributors and delivery companies, security companies, and landscapers, it's all about incorporating the PPE, the social distancing, and really trying to eliminate your exposure your person will have to outside risks, right? So you know that if your guys have to drive a truck, they're going to be exposed to that truck. So you go and you can clean it. We can take steps and be proactive. However, if they go to a restaurant for lunch, correct, or if they have to go to a warehouse or a distribution center to buy supplies or equipment for their job, right? That's a place you don't control. And those do present some risks. A study that's been out that is assessing the presence of bacteria and fungi has found there's some pretty interesting information around where you see the biggest concentration of that. James, if you don't mind, to the next slide, we could talk about kind of what that looks like. And so things that are dirty, right? And so how we measure kind of bacteria and fungal presence is a colony formed unit. So this is the number of units that could form a bacterial colony per square inch. When we look at a household toilet, that's a 172. The bottom of a purse is a 9.7. Money, which I don't know about y'all, but I can remember my mom always telling me that money could be dirty. It was 5.2, and yet we find at the gas pump, right, over 2 million CFU per square inch, and the actual buttons on the pump are at 2.6 because a lot of people come through and get gas. I think there have been some companies that have even tried to limit some of that exposure by putting policies out there in place.
Yeah, Tree, I can actually comment on one example. We had a customer that shared an email with us that their HR team had sent out company-wide across the nation, mandating that employees not go into the convenience stores while on the job, and even asked their employees to minimize going to the gas station to fuel their own vehicles. So immediately their branch managers subsequently reached out to us and asked us to start delivering fuel so that they could avoid having their drivers have to go and touch those dirty pumps altogether. And I mean, it's kind of funny when we look at this. I was surprised to see this data because I pretty much always wash my hands after I handle money, regardless of what's going on. And to see how dirty that gas station pump is, it's actually surprising and alarming. So I think those are some interesting examples of what companies are doing right now to improve their operations for both safety measures and also using things like mobile refueling. And unfortunately, as fleet operators right now, we need to all be cognizant of the risks we're exposing our drivers to, as well as finding ways to be more efficient in the way we refuel. So, so many fleets today are finding value, I think, in having fuel delivered and avoiding the gas station and reserving a maximum amount of time for them to do the important work their fleet is designed to do and keep their employees safe.
Thank you, Jeremiah and Tree. Yeah, I just want to add on that really depending on what industry that you're in and whether your essential business will play a huge factor in how you're affected. But what you can do to mitigate risk and potentially improve your business is deploy what a Tree had recommended to limit risks to employees, as well as what Jeremiah was talking about in taking advantage of the opportunities as they present themselves. I mean, and that's why so many fleets are finding value in fuel delivery services by avoiding the gas station and getting back time to do the important work that they need to do in this time.